Cristia Casillo and I'm a teacher at Balboa.
I'm Homie Sacha, I'm 16 years old and I go to Balboa High School.
My name is Matthew Morales and I'm a 9th grader at Bal.
My name is Angeline Canta and I'm a junior here at Balboa.
I was raised by a single mother, and so she constantly had 2 jobs. She had a salary job during the day and then she had freelance work at night. So I would say the main effect on health insurance was it was really vital for her to work more than just her day job in order to afford all of our expenses and to afford good health care.
Back in 7th grade, I got sick and I had to go to the hospital a lot. I had a lot of general checkups and then all of the bills add up and we had to pay thousands.
Well, my family doesn't really make that much money and we have a hard time paying for rent. So we can't really pay for health insurance and it's really affected some of my family members because some of them got sick but we have no health insurance, so we have to pay it from our pockets.
Healthcare affects my family financially. We can't afford the treatment for my grandma or my auntie that died because of cancer. My grandma died 2 months ago because of lung cancer. My 2 other auntie died because of breast and cervical cancer, and my uncle died because of liver cancer.
I didn't have anything too serious affect us, but we did have to contribute to medical expenses for my Lola, my grandmother, when she was alive because she couldn't afford all of her expenses on her own.
It was rough. We had to make a choice to stop going to the hospital because we didn't have enough money. So I had to deal with my sickness until now.
My grandma and my 2 aunties and my uncle chose to stay at home and not get the treatment because they know that we can't afford the treatment or the medical care. That's why they pass away.
Because of my sickness, it affected me profoundly, especially in school. I had to miss school a lot.
To me, it really hurts actually because we're supposed to have the right to free healthcare, but we don't really have it.
I would say because I was younger, most of the emotional weight was on my mom. There was definitely a lot of tension and stress, which of course made people's health worse because they were constantly worrying about how they could pay off my Lola's medical expenses. And that definitely probably affected the amount of attention and care I got. But overall, we did make it, but it really just meant that everybody was working harder, working more jobs.
Well, healthcare could be improved by making it free because there's people going through poverty and it's really hard for them to pay for it.
More free clinics or just drop-ins, cheaper medicines so that everybody could afford it.
I think people should get free healthcare. It's easy for them to get some medicine if they're sick.
I believe the U.S. healthcare system could improve by really, I think we need to completely reframe how we fund things in the U.S. We should increase spending on healthcare and social services. I think we should definitely have universal healthcare available here in the U.S. I think it's really ironic that we're such a wealthy nation and yet other nations have beat us to providing affordable healthcare for all people, and that does mean that people with more wealth need to be ready to sacrifice to share the wealth.